All right, let's call this to order. This is for the workshop meeting that we have presentations and everybody can update the board. We don't need to do roll call. We'll do that at 4 o'clock. But I do want to introduce our language justice folks because they're so kind to always take time out of their busy schedules. Diego and Gisela.
Yes.
I believe you all are going to do the language justice today.
Yes. Hi, everyone. I hope you can hear my audio okay. I'm Diego Ponce. I'm here today with my colleague Gisela Escobedo on behalf of the CLC, Community Language Cooperative. As always, thanks for inviting us to your meeting. We're going to practice language justice, meaning we're going to use simultaneous interpretation for today's Zoom meeting so we can participate both in English and Spanish. And after I finish saying this statement in both languages, we'll start the interpretation. At that moment, the globe icon is going to appear in your screens. It'll say interpretation, that globe icon. We'll ask you to please select it and to select your preferred language. And if you happen to be joining the meeting today on your cell phone or your tablet, you'll instead be looking for the More button or the 3 dots button to select your preferred language this other way. So if you're not fully bilingual, we'll strongly encourage you to select your preferred language so you can use the interpretation if anyone were to speak in the opposite language. And if you are bilingual, then just feel free to listen to everyone in their original language. As always, we like to remind all people in English channel, since English is a little bit longer than Spanish, just please pay attention to the speed in which you're speaking. Please make sure you're speaking at a conversational pace like this. And just please make sure you don't pick up your reading speed if you're reading anything off of your computer screen or a sheet of paper. Thank you so much for that. Buenas tardes a todos y a todas. Mi nombre es Diego Pons. Estoy aquí hoy con mi colega Gisela Escobedo, de parte de la Cooperativa Comunitaria de la Justicia y Lenguaje, el CLC. Y gracias por invitarnos hoy a su reunión, donde vamos a comprometernos a servir a la justicia y al lenguaje para poder utilizar hoy la interpretación simultánea aquí en Zoom en inglés y en español. Cuando termine yo de decir esto, se va a activar la interpretación y ahí en ese momento usted va a poder ver el icono del globo de la Tierra que dirá interpretación ahí abajo en la derecha de su pantalla. Por favor, elija ese icono del globo de la Tierra y por favor seleccione su idioma preferido. Y si usted está asistiendo a la reunión en su celular o en su tableta, por favor, busque la opción que dice More, que quiere decir más, o posiblemente el botón de 3 puntos para que pueda elegir su idioma preferido de esta otra manera. Y si usted no es completamente bilingüe, yo le voy a aconsejar que elija su idioma preferido para que pueda utilizar la interpretación cuando alguien está hablando en el otro idioma. Si usted sí es bilingüe, siéntase libre, por favor, de escuchar a todos hoy en su idioma original. Muchas gracias.
Diego, thank you so much. And thank you to Gisela as well. And just a reminder for board members and our presenter today, just to speak a little bit slower so that they don't scramble trying to get everything translated. Okay, we have got insights into communicable disease today, understanding the trends and response. Cody, I believe you're going to present.
Yes, and can you hear me?
I think we can.
Perfect. All right. So I am here just to present kind of a recap of 2023 and the communicable disease kind of profile that we had for last year. Before I begin, I do want to just start with a quick little orientation about what you're going to see in the next couple of slides. So normally, a lot of people are used to describing data with a mean or an average. In public health, we use a median because it's not as affected by outliers. So if you have 1 year bad data or something like that, or low counts or something, the average isn't going to be affected. So we always do a 5-year mean to kind of compare what we're seeing this year to the previous 5 years, and if it's what we expect or not. I do have a little sample data set here for you. And in this top row, you can see if we have 1 year with just one small count, like 2020 there's just one case, you can see the difference of what it does to the mean versus the median. Drops that mean down to 89.4, but keeps the median at 105. And if we look at that data, 105 is a lot more representative of what the past 5 years actually looked like, which is why we use that median. Another data set just below it that I have, and this is fake data for disease X, is kind of this little weird situation we're in here post-COVID pandemic. when we did have 3 years of substantial behavior changes, and with the pandemic and social distancing and masks, all of our medians are kind of dropped below what we would have expected if 2020, 21, and 22 were at those normal 100, low hundreds range. So you can see that the median is 75 for this data set. So let's go through these next slides. We got to kind of keep this in mind when we see if a count for 2023 is so much higher than that median. This could be an effect of reason why. We're also going to see that we compare data to Jefferson County, to the North Central region, and to Colorado as a whole. We do these comparisons to see if trends or things that we're seeing are unique to Jefferson County, or if they're the same and occurring across all regions in Colorado. We also can use this to see if Jefferson County is sharing a larger burden of illness than surrounding areas. We are part of the North Central region, and there's a little map of the region for people who aren't familiar with it. So how do we get our data? So this is a little flow chart of how JCPH is made aware of cases and what we do with that data. So it starts over there on the left with an individual is seen at their provider, and if they are diagnosed, or the provider diagnosed with them, or if they have a lab result that's positive for a disease or a condition that's on the Colorado reportable diseases and conditions list, then the lab or provider reports it to CDPHE. CDPHE then puts it into a statewide syndromic surveillance system called CEDARS, where each local public health agency can see the cases that are assigned to them. So it goes from CDPHE into CEDARS. Jefferson County Public Health can see that information, where it goes to our infectious disease epidemiologists, and we conduct interviews, pull some data out of those interviews. We store that data in CEDARS. It then gets sent back to CDPHE, and CDPHE will send that data up to the CDC. This process usually works pretty seamlessly. However, there can be delays in data getting to us. So sometimes we might have to send corrections or update data because we got a batch of late data. Some of this could be because there's a break in that chain, or if a provider or lab isn't reporting electronically with CDPHE yet, and they send like a batch of faxes over. All those faxes have to be manually put into CEDARS, and that just slows things down. So here's a list of a short list of selected diseases and conditions for 2023 that we investigated. These were chosen because these are what we primarily spend our time on as epidemiologists here at Jefferson County Public Health. And this list consists of foodborne illnesses, vaccine preventable illnesses, respiratory illnesses, and then we got West Nile down there at the bottom. That doesn't fall into either of those categories. We do most of these investigations, but there are some that CDPHE will investigate for us. So all of these conditions here, if you look in that first column of highlighted data that says Jefferson County, that first column, January to December of 2023, is the total number of cases that were reported into CEDARS for us. The column next to it is that 5-year median. So that's the median from 2018 to 2022. So you can see going down that list, all of them have increased and they're above that 5-year median, except for hepatitis A. But some of the stronger things we want to point out are if you look at things like West Nile virus down at the bottom, it has a 10-fold increase from the median, from a 5-year median of 6 cases per year to last year we saw 65 cases. Pertussis has almost doubled, and varicella is almost, or chickenpox is almost 3 times as high as that median. Basically what this shows us is there's a lot more cases that we're investigating as epidemiologists compared to what we've seen in the past. I do have the North Central region in Colorado up here. The numbers are kind of grayed out because I didn't want to focus too much on them. But the increases that you're seeing in Jefferson County, they translate to North Central region and Colorado. It's nothing unique to Jefferson County. We're seeing these increases across the board. Kind of looking into this a little bit, deeper in kind of a different direction. If we look at the proportion of disease or illness based off of the population in Jefferson County compared to the North Central region and to the state, there's a few illnesses that kind of jump out at us, and I kind of highlighted those on this chart. So in the North Central region, Jefferson County's population accounts for 17.4% of the North Central region. If we look at the amount of cases reported in Jefferson County and we take that proportion, meningococcal disease is 23% compared to that 17% that Jefferson County's population makes up. Pertussis is even higher at 37%, and West Nile virus is 19.5%. Jumping over to the state, that also is seen in the state. We are at 9.8% of the state of Colorado's population, but we contribute 17.6% of the meningococcal disease to the state's data, 21% of pertussis. I tossed a slide in here for sexually transmitted infections because they are reportable conditions, they are communicable, but they're not something that we as epidemiologists at Jefferson County Public Health work on. CDPHE does these investigations and they do the partner notification, but I felt it was important to put these in for a 2023 profile. These numbers, we don't have a lot of information on these numbers as CDPHE, since they do all the investigations, they kind of hold these numbers close to their chest, which makes updates and getting updates on these numbers fairly difficult. We do get a quarterly update, but getting it between then has posed some challenges. We do see the same increases though across the board for all of these infections, with syphilis numbers being a pretty big concern right now to JCPH as well as the Denver metro area. And we are working with other Denver metro area counties and LPHAs to implement strategies to reverse this increasing trajectory that we're seeing with these. So some things to point out is not all of these illnesses are just kind of happening. So we do know that in 2023, there were 2 salmonella outbreaks. There was one in cantaloupes that affected 44 states, including Colorado. And also fresh diced onions had a salmonella outbreak that affected 23 states. So those outbreaks, cases that are there, have contributed to the rise in Jefferson County as well. West Nile virus, we don't have concrete data as to why there are so many cases. It's hypothesized that due to the wet winter and the wet spring that we had in 2023, that there's just a lot of breeding habitat for the mosquito that does carry and transmit West Nile virus. But research is ongoing on this. There's actually a One Health Zoonosis conference that is next month, I believe, where researchers from CSU will be presenting some data on this. So I know a lot of us in Epi are excited to listen to that and get a little more insight as to what was going on with West Nile virus last year. And just as a reminder, West Nile virus was 10 times an increase from that 5-year median that we saw in 2023. And then also varicella, that had a 3 times increase from the numbers in 2023. And the increase in varicella is can be partially attributed to unvaccinated individuals. JCPH clinic is working with the clinic and Epi and the surrounding LPHAs to hold mass vaccination campaigns to help reduce the number of unvaccinated individuals in the community. And then we do like to tie this into the CHIP. So we have the relationship to the CHIP. One thing that we are seeing is a lot of our infections, they tend to be seasonal. So I have 2 seasonal infections here. I have West Nile virus on the left and cyclospora on the right. And the rate of infection is in both of these charts is shown over the past 5 years, but I've highlighted 2023 so we can see. So not only are we seeing an increase in the number of infections that we're seeing, we're also seeing that the season or the time period that these infections are primarily happening is widening. So West Nile virus, we normally see cases starting late August, early September, and ending by October. In 2023, cases started as early as August. and went all the way through November that we were seeing cases. And that same thing happened with cyclospora. And this isn't just limited to these two pathogens. We're seeing it in a lot of our seasonal infections. And that was kind of my quick profile. Are there any questions that the board has?
Are there questions for Cody? Sarah, I see your hand up. And I see you.
Hi. Hi. Thanks, Cody. I really appreciate it. I was off camera. I've got a kid around. Jeffco's on spring break, so didn't need to have children dancing in the background. So thank you. This was so it's just so great to see and understand a little bit more. If you go back to the slide where you were comparing Jeffco to the state, yeah.
Yeah.
So you highlighted necessarily so the areas where Jeffco's contribution is outliving the North Central's expected contribution. But I'm curious actually about the ones where Jeffco is performing well, where our percentage is actually lower than where our population percentage might be carrying. And if you know, like what you might be able to speak to as far as those particular infections where it might be lower. And why that might be, or if you have anything to say about those.
Putting me on the spot here. Areas that were lower. I don't have anything off the top of my head right now, of why this might be.
It's okay. I wouldn't expect you to. I just was curious if there was anything that came to mind to you.
Yeah, but I'm happy to actually take this back to the EPI group and kind of put our collective brains together and figure something out, and see what we can come up with and kind of report that out later. But off the top of my head, where we're doing better, I can't think of a notable reason why or anything like that.
Great. Thank you.
Yeah.
Are there other questions from the board members? Okay, I am not seeing any. I'm not hearing any. Cody, thank you for all the work that you all do and that all of your colleagues work with you on.
Yeah, no problem. I'm happy to present.
Appreciate you. Okay, it looks like we're a little bit, do you have anything more that you wanted to share with us, Cody?
I don't have anything more. That was the end of my presentation,
Okay.
for this, yes.
All right. Well, then we have about 10 minutes and then we'll start the 4 o'clock business meeting.
And if anybody does think of questions, I have my email up there. Feel free to send a message along and we'll see what we can find.
Okay, thank you, Cody.
Thank you. Have a good day.
Well, it is 4 o'clock. We should call this back to order for our business meeting.
Sherry, would you like me to take roll call?
Yeah, are we all ready?
Yeah.
Okay, yes, we will call this to order at 4 o'clock p.m. And Lindsay, will you take the roll call, please?
Sure. Sarah Lampe. Present. Rochelle Woods.
Present.
Sherry Jean.
Present.
And for the record, Blaine Drager and Harriet Hall are both absent and the quorum has been established. Thanks.
Thank you. And again, we want to thank Diego and Gisela for being our language justice folks today. Do we need to go through that again, Lindsay, do you think, since we did it at the beginning? I mean, I think we had more people sign on, but
I think we're good, but Diego and Gisela, if you feel like you need to, just let us know.
okay, I am not hearing anything. We have a consent agenda. We have the acceptance of the agenda, the approval of the February Board of Health meeting minutes, and approval of the warrants. Is there anything on the consent agenda that anyone would want to have removed to discuss? Nope. All right, may I get a motion to approve?
Motion to approve previous meeting minutes.
The consent agenda in full?
Sorry, consent agenda. Wow,
Yeah,
sorry.
that's okay.
Motion to approve consent agenda. Sorry about that.
Do we have a second?
I'll second that.
And that was Rochelle.
Yes.
All righty, thank you. All those in favor, please say aye.
Aye.
Any
Aye.
opposed, please say no. Hearing none, that motion passes. It's approved. Public comment. I know that we had checked previously and there was no one signed up. Lindsay, is that still current?
Yes, that's still correct.
Okay. All right. The financial report. Oh, I see she popped right on. There you go, Salma.
Good afternoon, everyone. Can you hear me okay?
Yes.
Okay.
Yes.
Go ahead and share my screen. Right. So today I will be presenting the February 2024 Department Financial Summary. And just move this here. And as of this reporting time frame, it appears that we've collected 20% of our total revenues. And I am excited to announce that to report that we are on target with our grant revenues, while we are continuing to be ahead of our charges for services due to restaurant licensing fees that are collected in advance to support our retail food program throughout the year. This slide just to provide you with a snap picture of where we were with our revenues last year versus this year. So as you can see, last year we've collected 13% of our grant revenues versus this year 16%. Few notes that I wanted to bring to the board attention is that we did indeed identify an overstatement of our prior month retail food revenues, and we were able to make the necessary adjustments. However, we still collected 79% of our retail food budget. And I do recall a question that came up about regarding whether we had any establishment closed this year. Unfortunately, we did have 37 establishments closed. However, we were able to recoup some of those revenues because we had a significant number of change of ownership.
Thank you.
When it comes to our expenditures, we are right where we expect to be, 13%. I've provided February 2023 just to show you that we were also at 13% last year. And this is because we, at this time of the year, typically the county doesn't allocate any interdepartmental charges. So they are currently reported at pretty much 0%. The few items that I want to highlight from the slide is the direct assistant line item, which is payments to students for internships and incentives. The major difference between last year, we reported 70% versus 103% is that we did issue these payments early this year because the student completed the internship last month. The item that we're still trying to get caught up with is intergovernmental or payments to state for those restaurant licenses. And when it comes to our net asset or county transfer, we've utilized 5%. This time of the year, we've utilized 7% of the year. Last year, we've utilized 7%. And that variance is expected because of the revenues that were collected or the additional revenues that we collected this year. So that's all I have for today, unless if you have any questions.
Great, thank you, Salma. Are there questions for Salma on the financials?
I do not have questions.
No questions.
Thank you for
Great.
your time today.
Then what we'll ask for is a motion to approve the financial report.
I will make a motion to approve that.
You have a second? It's all up to you, Sarah.
I said second. Did it not come through? Sorry.
Oh, sorry. I didn't
No,
hear.
it's okay. I think my hand is over my mouth. Sorry.
All right, we have a motion. We have a second to approve the financials. All those in favor, please say aye.
Aye.
Aye. Any opposed, please say no. Hearing none, that is approved. Thank you. We'll go right into the new business. And we have the secure transport briefing that I believe Christine, our distinguished Christine Billings, is going to give us.
Hi, Sherry.
Hello.
Yes, good afternoon, everyone. Christine Billings, Acting Deputy Director for Jefferson County Public Health, as well as the Division Director for Epidemiology, Planning, and Communications. We wanted to follow up in your board packet. You will find a memo from the Secure Transportation Program, which is a little status update. Back in October, Anjanette presented the launch of the program and a lot of detailed information. I believe, Sherry, when the fee structure was presented in an education section, you had a question about the secure transportation program. So we thought it was timely that we provided just a little status update on how it was going and some of our challenges and opportunities.
Great, thank you.
Yeah, Anjanette's off celebrating spring break with her little one, so I'm here this week.
We're happy to have you.
Yeah, so just as a little reminder, the House Bill 21-1085, which was adopted in June of 2021, sort of set forth the requirement that boards of county commissioners set up a regulatory system for secure and private transportation for community members experiencing a behavioral health crisis. And so each county commissioner group delegated that differently. Some hold that responsibility themselves within their county management structure. Here in Jefferson County, that has been delegated to JCPH. It follows suit along with the ambulance licensing program. So if you are familiar with that, it made a lot of sense that JCPH would also hold the responsibility for the secure transportation program. We are getting amazing support from the county attorney's office, so we want to be sure to thank them publicly for that support that is being given as we set up and adopt new systems that are in alignment with the ambulance program, but different because it's a different program. So to date, we have 3 licensed agencies. We launched in January of 2024 within Jefferson County. Arvada Fire was our first agency to step foot and say that they wanted to become officially a secured licensed transport agency. They have a specialized vehicle for this, and they got it inspected, permitted, and it is now licensed and they are using it. There are 3 set fees for the program, which have already been shared with all of you as the board. There's a fee for inspection, there's a fee for permit, and then if someone fails to pass that first inspection, there's sort of a re-inspection fee that we charge. Built into that structure is sort of an administrative coverage charge. So Jefferson County Public Health is the lead for what we have called a multi-county intergovernmental agreement. This IGA is with 7 counties across the Denver metro area. And the benefit of that is that it provides reciprocity in terms of agencies moving patients in and out of county borders. As you all probably saw during COVID, are well aware, at times capacity in certain agencies, hospitals, behavioral health centers, wherever these individuals need to be safely transported to, sort of ebbs and flows depending on what is going on in the system as a whole. So this reciprocity, both in ambulance licensing and now in secure transport, allows for these patients to receive care and not be bound by county borders. So there really is a really great benefit to a multi-county IGA. With that, of course, comes the challenge for Anjanette and team to coordinate all of those agencies to gather agreements. The county attorney's office worked hard to get that IGA set up and coordinated with the other legal staff in the other agencies. So again, with challenges come opportunities. So there are different permit classes types based upon whether there's a partition, what type of transportation is being used, whether restraints are needed or not. Some of our challenges, the state requires an extensive amount of data to be shared back with them. Different than the data that the ambulance program required, and so new systems needed to be established. Applicants, so those that are seeking to become licensed, are asking questions beyond the knowledge bank that a health department or any of the other IGA counties have within their knowledge. And so there's a lot of back and forth time with the state, who is the regulatory agency, asking questions and then feeding them back to the applicants. Probably time that didn't need to be spent once I get to one of our opportunities. There are language barriers. So the materials that the state provided that we've adapted, currently they're only available in one language. So if there are other languages, other agencies that speak languages other than English, these documents have a barrier to them because they are only written in English. There is a challenge. We are required to maintain that publicly accessible list of participating agencies. So each of those counties, because we are in this reciprocity, are required to list each of the agencies across the board. And so each website has to be maintained and publicly accessible. While this is easy for us, I would be remiss if I didn't share the challenges of the program as a whole. Colorado will be assuming the ambulancing licensing program starting in July of 2024. And with that comes all of the fee collection. So we collect fees for licensing ambulances. We no longer have to do that. And so the state will be collecting those fees. Licensed ambulances are exempt from paying for a secure transportation program license. So if you extrapolate forward, we have several ambulance companies that are licensed within Jefferson County. Currently, we receive fees to inspect and license those agencies. Now those fees are going to the state, but we still have to issue them a license. And so there's sort of this unfunded mandate, I would call it, coming with the ambulance licensing program moving to CDPHE. Now, don't get me wrong, Anjanette is very excited for July of 2024. It is a lot of work. And so we're happy that the state is taking that program. There were a lot of lessons learned during H1N1 related to the ability to know how many licenses, ambulances there were in the state of Colorado. They had to do a lot of digging to find that number because the licensing was held at the county level. Again, you could extrapolate that forward. They're going to be missing some data with the state secure transportation program as well, because it's held at the local level. Also a challenge and sort of a shining star is that JCPH and this multi-county IGA are considered best practice. And because of that, we get loads of questions from across the state, and we get lots of counties that want to join into that IGA. We don't have the bandwidth to do that. We cannot support a statewide licensing program for secure transportation, even though we do it really, really well.
Can I interrupt just a second?
Yeah.
Christine? Go back to that other slide. You said that although Jefferson County is the one that's going to be the one overseeing this and doing the licensing, but the state is going to charge the fee and keep it.
Sort of. So for licensed ambulances, who want to be a secure transportation vehicle for behavioral health crises, they do not have to purchase a license from the county because they are already licensed as an ambulance.
Okay.
Currently, we get the ambulance licensing fee because we're running that program.
Mhm.
That is moving to the state. So they're going to get the ambulance licensing fee. We still have to issue the secure transportation program permit or license, excuse me. And we do that without a fee because they've already paid the fee to the state. So we are doing work without getting support for that.
Yeah,
in
I
that
caught
point.
that. I did
Yeah.
catch that.
There's a couple of opportunities. I'm sure you can see where this is going. One opportunity is that the North Central Region Healthcare Coalition has a behavioral health committee, and they have expressed interest in leveraging the power of the secure transportation program, the knowledge that comes with that, to help support disaster response for behavioral health evacuations. There was a hospital in the fall who needed to evacuate because of a heat pump failure. And with that came moving some pretty complicated behavioral health patients and trying to find enough secure and safe transportation units to move those patients became a challenge. And so having this system at the local level where we're really used to coordinating really well is definitely a really good opportunity. The other piece, the transition from the program to the state, it would be great. They're taking ambulance licensing. We would sure love to see them take secure transportation as well, for all of the reasons that they would want to know why they want to have ambulance licensing. They want to know that there is consistency in accountability, consistency in inspections, consistency in requirements, and knowledge of how many vehicles are out there. So if it's one hospital that's evacuating, we can coordinate at the local level. But where you get multiple hospitals that cross county borders, the coordination of that event rises to a higher level. And having the program at the state allows them to leverage that resource in a different way. So those are two opportunities. Also, the whole cost piece from the previous challenge slide. So that's all I have. That's it. 3 agencies, lots of work, really great collaborations, conversations, but also some pretty big challenges and opportunities on the end.
Thank you, Christine. I'll be anxious to hear the updates as we go along for that.
Absolutely.
Are there questions Are there questions for Christine? Sarah Lampe, you have your hand up.
Yeah, I have a couple questions. Why is it not already state-based? And then I have a couple other questions that is it because that's how the bill was drafted and written and that's why it's not?
Yeah.
I'm really curious why. It is from bill language. Okay.
Yeah, it is in bill language, and the bill was passed before the decision to move secure or ambulance licensing to the state occurred, which was really put into motion during COVID when they just frankly had no idea what they had at their hands. And so the timing was a little off to help support that opportunity.
Mm-hmm. Okay. And does it seem like that's likely going to happen?
I would sure love to hope and think so, but there was a lot of background work related to moving ambulance licensing that I think they want to get that settled before we can lean into that opportunity. But I'm going to keep the board updated because I think there will be maybe a year from now, I would hope that we could maybe lean in a little bit about looking into that.
Yeah, I think that'd be a good idea.
Is there any, sorry, I have like a million questions. So I can,
A million.
so many. I have so
It's
many.
all you, it's all
Is there-
yours, Sarah.
I'm sorry. Is there any ability to like, this is probably not possible, but is there any ability or any conversation advocating for billing back for those free, like the no cost licenses you're providing to ambulance services to the state to say,
If
we're
only
doing
it
this
wasn't
for you
written
and you're not
into, yeah, it's in the language of the bill.
I need to read the bill.
Yeah,
Okay.
you're good.
Okay, well,
You're good. It's in the language of the
question.
bill and the regulations.
all right.
And so we are stuck. And for now there's 3 agencies, right? But there are multiple agencies that are ambulances that are licensed across the county and the IGA. It has the potential to become a really, really big concern.
Yeah.
Well, it sounds like it was a department bill to me.
Yeah. Okay, I have one more question.
I'll smile.
But
Okay.
then I will stop.
Sarah?
You stated that you provide significant amount of data to the state in relation to this program. Does any of that data come back? Is there any utility in that data for Jefferson County whatsoever to know and understand? Or
Yeah,
is it
that's
really
one of
just
the
pumped in and not pumped back?
Yeah, that's one of the questions. So the coordinators of each of the counties are really pushing on the state and submitting a lot of inquiries as to where is this data going? What is it doing? How do we get it back? Because I think there are great lessons learned if you can look statewide to see what's going on. For instance, we know that there are certain counties that are charging a huge dollar amount for licensing, and we did not feel comfortable with that, especially starting a program from scratch and having zero data to back that on other than an ambulance licensing program. And so yeah, that that they're pushing on it with inquiries as to what that is doing, but nothing.
Okay, that's it. I'm done. Thank you.
Okay, well, that wasn't a million. Any other questions from the board members?
I don't have any questions, but Christine, thank you for that presentation.
Yeah, you're welcome.
Okay. All right, we will continue forward. We have a post-COVID-19 transition of infectious disease response. And Christine, I know that's underneath you, but I'm going to let you introduce your colleague, Angel Anderson.
Yeah, so thanks. Yeah, thanks, Sherry. So I am pleased to present officially Angel Anderson. She is our infectious disease epidemiology supervisor. So she is going to share a little bit about what the team has been doing in a really great way related to transitioning out of COVID-19 into routine infectious disease. So I know you all know Angel, but I'm officially introducing her and handing over the screen share to her.
Thanks,
Welcome,
Christine.
Angel.
Thank you. And Cody's actually going to run my slides because he's the tech savvy person. So,
Oh, good.
yeah. So as Christine said, I'm Angel Anderson. I am the infectious disease epi supervisor, and I want to provide a brief overview of a year-long project that our team has been working on. So in addition to all the cases that Cody has presented to you, our project has been focusing on transitioning from COVID-19 to normal operations. This project was led by Amy Comfort, who is on much deserved PTO spring break this week, and had a lot of contributions from our entire EPI team of Carla, Cody, Joy, Melanie, Shannon, and then we had some data analysis provided to us by Kate and Becky from the data team. Again, this project was to integrate COVID-19 into our regular communicable disease work. It had 2 parts to it. One was a survey that included our community partners that we worked with during COVID and the Jefferson County staff that also worked during COVID. And this was to evaluate how we as local public health responded to the pandemic. And as you can see, the table of respondents, we had schools, childcares, non-government, non-JCPH government partners, and then case investigators and epidemiologists. And then the second part was taking the information of what we learned in the survey and updating our response plans and adjusting our day-to-day activities. You can move on now, Cody, thanks. And this is kind of an example of the questionnaire that we sent out. It was a gap analysis survey. We provided you with the whole survey in your packet. As you can see, the darker green to the left indicated a higher level of agreement to the survey question, and then it went down to the right to the light green and gray to disagree with the question. And the majority of our community agreed overall with all of our statements. We had between a 63 and 83% agreement with those questions. Next slide. We also asked for qualitative responses, which led to themes to help inform our response plans and changes in our daily activities. In general, the responses showed room for improvement in always communication, in our reporting processes, and ongoing collaboration. Some of the improvement outcomes that we've instituted since this began were we've created some pre-approved letters and email templates for streamlined and prompt correspondence with our partners. And we are in the process of testing a survey form for disease and outbreak reporting for all facility types across all of our pathogens. Respondents also believe that having a direct relationship with one epi for the entire amount of their outbreak was very beneficial to continuity of communication, and this was a practice we put we instituted early on in the pandemic. Next slide, please. So after our survey, we looked at our response plan and we reviewed them and changed quite a few of them, updated them. It's been many years since we had updated our plans. We also added a few that were relevant, and those were some of the highly infectious pathogens like bioterrorism, emerging respiratory pathogens, which we folded COVID into that, as well as HPAI, the highly pathogenic avian influenza, and pandemic influenza and tuberculosis. We added a viral hemorrhagic fever plan, and our measles and community containment plans were already existing, but we did update those as well. And currently, we have nearly completed all of our plans. We're about 88% done with those, and we will begin a process of annually updating those. So since this project was mostly completed during the fall and the winter of 2023 and the winter of 2024, our next annual update will begin in 2025. Next slide. Additionally, Amy and I will be presenting this project next week at the Preparedness Summit in Cleveland as a process improvement best practice. And Amy will be presenting in July at the 2024 NECHO 360 conference in Detroit. So pretty excited about those.
That's wonderful.
Any questions?
That's really great. And I really appreciate how you reached out to the community, partners and all the organizations that we work with, the schools, et cetera, to get good response like that. I think that was very beneficial.
Yes.
The whole thing caught everybody off guard. I mean, who was ready, right?
Right.
It sounds like you've got a good plan, and I really appreciate you working on that.
Thank you.
Sarah, you have a question.
I'm just really chatty.
Just
Really
one?
full of questions today. I don't know. It might be multiple, but I'm going to start
Okay.
with one. Angel, thank you so much. This is so great. And I really appreciate the theme of communicable disease from the presentation we received prior to the business meeting and this one as well. I'm curious about how much or how your plans and information are being shared with the state. I know often in COVID, the state was a big part of the response efforts and often got mixed in aspects of different public health response, to understand how there can also be improvements in those communications and relationships so that doesn't create ongoing issues should we face other outbreaks in the future.
Well, we haven't officially shared the plans up the chain to state. We've shared them with partners, other local public health partners. So I think that's a quality improvement. We can send those to the state to have them review and look at them, definitely.
You know, Sarah, I think that is an excellent question. And just to piggyback on that, I would think that it would be a really important thing for the state to do, to reach out to everybody else to ask these kinds of same questions. How could they have done, you know, what have they done? What are they doing different, et cetera, et cetera. So that's a really good point, Sarah. I think that somebody should nudge them that they should be doing that too. Sarah, you had any more questions? I was waiting.
I know. I have so many. But
I think it's great. You asked
hold
great
back
questions.
on several. Is there, I mean, you highlighted a lot of really great things. I'm trying to think of how to put this question. No, I'm not going to frame it very well. You know what? Never mind. I think I'm gonna pause. I gotta take a minute to put my thoughts together for a second. I'll come back.
We can always, if you do, we can always, you know, pop a question in during the board discussion too, the board updates. Well, I really, really appreciate, Angel, you doing that, and to all of your colleagues, and Christine, I know that you've worked hard on that too. So thank you to you all. I think this is really great.
Yeah, and I just also wanted to add, Angel, congratulations on the presentations that you and your team will be doing at these conferences.
Yeah.
Those are huge, and you deserve to be celebrated for that. I'm excited for you because it is a big deal. And I just want to say, you go, girl. Keep up that good work and do JCPH proud at those presentations. And I know you will, but I am just over the moon knowing that you guys are doing that. That's awesome.
Thank you. Thank you.
Thank you, Rochelle. Okay. If there are no further questions or comments, we will go ahead and move forward. We have some department updates, and Dr. Story, I'm going to turn it over to you. Hello, hello.
Hello. I hope you're all well. I'm loving all the questions. It's very exciting. I have some good updates today for all of you, and then I'll turn it over to the team. We've got some fun stuff. Let me share my screen. Okay. You got it? You see it?
Got it.
Okay. Happy March. It's almost spring. Tomorrow is the first day of spring, which we're very excited about. It's also National Nutrition Month, which we have taken a slightly different angle about. So we're really focusing, just expanding beyond this idea of a healthy plate, right? And what I tell the team is like a cartoon carrot, which is kind of the national campaigns are often, you know, in that space. And so pushing our wonderful designers to really rethink the way we talk about nutrition and we talk about food. And with all of the narrative happening in Jefferson County right now, and sometimes pretty, you know, pretty nasty narratives about culture and differences and community, we thought it was a really good opportunity to kind of highlight a crowded table as an opportunity to think about nutrition differently. And then you start to really dig in, and one of the things we're really pushing on, and I just earlier today, the comms team arranged for an interview about this, but food insecurity in Jefferson County and just generally household economic resilience as part of the chip, the numbers are pretty startling. How many people we think are, skipping meals at the end of the month, and having a hard time making ends meet. Just to bring it back to a little bit of like joy and community, I also thought was really important. So these are our, like, it's part of our social media images. You can see them on our LinkedIn or Instagram. We would really love it if you share them and just add a little bit on top of it. I did a little number crunching, and I want to thank Sean. He's our informatics expert in environmental health. I said, hey, can you tell me any restaurant that sells food? It is a small business and the food is like maybe from a different country. And he said, there's no way I can tell you that. I was like, okay, then just send me a list of all the small businesses. And so he sent me a list of all the small, like, restaurants and mobile food trucks. And I wrote a little computer script to try to estimate how many restaurants like represented food from other cultures, outside of our country. And it's a lot. And it looks like it's about 900 small establishments, including food trucks, that are selling food from Mexico, Venezuela, India, Greece, Germany was in there, the African continent, Thailand, Vietnam. So Jefferson County is, a cornucopia of food and different cultures. And that's what we wanted to just celebrate and draw attention to. So we would love your support in sharing these images, because we think they're very beautiful. Another thing to keep an eye out for is the county health rankings and roadmaps, which you may be familiar with, which is sponsored by the Robert Wood Johnson Foundation. In past years, they used to, you may remember, a county would say, we're the healthiest county in Colorado. Well, they're not ranking anymore. It's really more about kind of data access and equity, and highlighting national issues that they really want to bring attention to. So we were able to access embargo data to get ahead of it a little bit. So over the next couple days, Tuesday, Wednesday, Thursday, we'll be doing a series of thought leadership posts about what we found in the data. And one of those posts is really going to be thinking through how you dig underneath county data in order to illuminate stories that are kind of hiding in those different pockets. And that's what we're really committed to. So, it's no shade thrown at county data, but it really just tells kind of a glossed over story. And we're trying to go deeper than that. So again, would love your support. We would especially love your support on LinkedIn. If you're on LinkedIn, anyone listening to this, staff especially, when we repost on LinkedIn and add our own thoughts, it really does elevate. To Rochelle's point about conferences, think of it like one virtual always on conference where people really are looking for the next thing to invest resources in. So it's not really just about visibility, but it's also about resource allocation. And so it's really important to amplify that work. So that would be just ask a small favor of you. Speaking of conferences, NACCHO decisions came out about sessions that have been accepted. The conference is a little shorter than normal, so we were, cautiously optimistic. We had 6 different teams put forward proposals. I think I stood right here in front of you and said, I bet we'll get maybe 3 of those 6 teams accepted. We got 5 of 6 teams accepted to NACCHO, including one of the hardest things to get. And if you're not familiar with NACCHO, it's the national convening of all county and city health departments. So this is the big show, I keep calling it. It was in Denver last year. This year's in Detroit, which is one of my favorite cities. So very excited. I'm forcing everyone to go to the Motown Museum with me. I was shocked that we had 5, and I was most shocked that 5 teams were accepted. That's actually 4 sessions across 5 teams, because one of the teams submitted 2 different sessions. But I especially want to call out Points West, our harm reduction team, for getting a workshop, a pre-conference workshop accepted, which is almost impossible to do if you're not, a think tank or a training institute. There's only a handful of slots for 2-hour workshops that people sign up for ahead of time. So this is the most engaged, most excited folks are there early to take workshops. And that's on dismantling stigma. And the other 3 listed there, which I'm going to mention one of them in a second, actually. And then Chaos to Clarity, which you just saw talking about going to EPR, also going to NACCHO, also going to APHA. So they're hitting the trifecta, but for most of us, NACCHO is the biggest event of the year, and where all of the health foundations and kind of national think tanks and funders look for, you know, their next shining stars. So congratulations to all of these teams. It's huge. One ask for the board, these teams don't know it yet, but I am requiring that they do a practice run through, and that all staff have to commit to volunteering their time for one of these teams to participate in a mock session. I would love it if board members could attend one of those. We'll make sure that they're on your calendar. And if you could pick one and come and role play being a ornery NACCHO attendee and ask really tough questions, I think the teams would really benefit to shake off those nerves and get that out of their system before they go in front of a live audience. So look for that coming probably in May and June. The conference is in July, so those will probably happen in June, but we would love to have you there. This is supposed to look like an Easter egg. So we, as I've mentioned before, we established a new employee recognition program, which is really grassroots in the sense that anyone can nominate anyone. We do set some guidelines. We ask for like a minimum essay length about their nomination. Those nominations go to the directors of those divisions, who pick a couple to put forward up to me and Lindsay, who are the what Lindsay's coined the selection committee up to. And what we've established is there will be an employee of the month. Those board members who can meet us for lunch will get to meet them this month, and we'll talk more about that in a sec. But we also wanted to recognize people who had just some nominations that were just too good to pass up. And we call them the honor roll mentions. I am now calling them the honor roll. And instead of doing the fancy lunch, they do get a bonus, and they do get the extra hours of leave, like the employee of the month at a smaller scale. And they also get a fun lunch in the conference room. So this was our first month we did it. And these are our 3 honor roll recipients. They attended a super fun, not awkward pizza lunch with us and their nominators, who got to say amazing things to them, to their faces. And it was so sweet. And we had such a blast. I was worried. I did come up with an icebreaker. I told Lindsay I was worried we would all just be staring at each other eating pizza, but it was so amazing to hear. Like, I get choked up just thinking about their colleagues looking at them and telling them how much they mean to them, like, and just eating pizza and enjoying ourselves. Like, such a small investment and such a great payoff for all of us in that room. So can't wait to keep lifting up the honor roll every month for you. And we'll have Joe will be talking about our employee of the month in a bit in his update. So congratulations, Karen. She's in clinic services. Andrea, she's does a ton of stuff, and she's over in community health partnerships, and Jackie's in environmental health. And the cool thing is that you can nominate people who aren't even in your division. And today's employee of the month that we'll be announcing was nominated by someone on a completely different team. So that's very cool to see that happening. So last, congratulations. You may remember the mobile home weatherization project that was funded as a pilot project. That team won a very competitive expansion grant. So we'll be moving that work in the climate adaptation for manufactured homes. It's going to be moving to another community. And we got word today that the county climate action plan is actually interested in adding to the pot. So we may be even going to another community. So congrats to Jess and Debbie and Nikki for making that happen. The County Health Improvement Plan presented to the Board of County Commissioners last week, yes, a week ago, by Amanda and Myra, who have been in front of you, and they did a lovely job. And the commissioners gave their thumbs up, very supportive. Their questions were like, how does this interact with everything else? How will we make sure that we have partnerships moving forward? So that was really good feedback to hear. I will send you these slides. Great link on the Love My Air program, some media that's been around that. So congratulations to that team. We're kicking off a rest of the year long intense training for people managers, focusing on giving and receiving feedback and creating like a culture of trust. And thank you to Alex Hopkins and Jessa Woodward and Donna Viverette. They've been really instrumental in that people managers meeting. This is above and beyond what their jobs are. Karen Wiggins as well, who's our HR specialist. They have really just taken leadership of this. And so our people managers are going to be phenomenal, even more phenomenal than they already are, but this is where it starts. So kicks off next week. Lastly, I know that was a lot. Lastly for me, we are working with the county. We're developing a new student experience for high school interns this summer. And we are so excited we'll be implementing 3 different kind of career pathways, research pathways for these students, probably be about 9 to 12 students. They are supported by county dollars, by stadium funds. So this is actually not costing us anything except our hearts and souls and blood, sweat, tears. So there will be a pathway devoted to kind of like peer-to-peer education on tobacco. There will be a pathway on emergency preparedness, which I think will be really fun for some of the students. I think it's going to draw in a really different type of student than we see. And then there's going to be another pathway devoted to applied research, social determinants, and creating communications campaigns. And so those students will be here at the board, likely reporting out on their experience and presenting what they've created to you to give them some experience in doing that. And maybe we can even do that in person. So that would be really fun as well. So lots of talking from me, but so many cool things happening. No updates on like budget and things we've been talking about, in study session related to the 2025 budget, but you all will know as soon as we know, but we're kind of in a dead zone right now when it comes to progress on that. So now I'm going to turn it over to my colleagues. First, I want to ask if there's any questions for me on anything you've seen, because I know by the time we get through all this fun stuff, then you might have forgot what you wanted to ask me. So here for you if any questions.
Any questions from the board? No, you did a great job. Thank you.
Sounds exciting.
I just want
Michelle, is that you?
No, it's Sarah. Hi. Just wanted
Oh,
to
Sarah,
add,
there you are.
huge congrats to everyone for all of the presentations and sessions. And yes, the pre-conference session at NACCHO is near impossible. So what an honor. And I'm excited to participate and be a heckling potential NACCHO participant to support you all in your presentation.
You said heckling, not me, Sarah. So I am very excited about that as well. And I love that I got to break that to the staff on this public meeting, that now they have realized that they were going to have to do it ahead of time in front of us. So excited to have you there, and thank you. And I know it is a lot of people to send, and I do want to recognize like the financial stewardship of this approach, but just knowing that NACCHO really is the one big thing a year that I think is kind of the debutante ball. We did not have a very large presence. The department was otherwise concerned with things like the last NACCHO, which was here. But I think as the director, it is a worthwhile investment if we set some goals around what we're trying to accomplish and who we're trying to woo while we're there. And it isn't just about networking, it's about bringing back some new ideas, but also potentially new resources and relationships. So it is worth it, and it means we have to kind of cut back on some of that regional or state travel and professional development, but I think it's a pretty good trade-off. So I made a promise to these teams, if they applied and got in, they get to go. And so once all 5 got in, and Joe was like, remember that promise you made? I was like, okay, yep, we'll make it work. We'll find a way to make it work, So a woman of my word.
Well, thank you.
Of course.
Okay, you wanted to turn it over to are you
I'm
calling
going to turn it over
Kelly?
to Kelly. Yeah, I'll call ask Kelly to just do these updates. But I did want to, before that, Christine is not on this list because you got to hear from her about everything else. So we thought she had such a starring role on the agenda. But I did want to check in with Christine just to make sure, if you're still here, that like there wasn't anything else you needed to add from either of the hats that you're wearing. I didn't leave you off. Like I did leave you off intentionally because you had that other time we chatted about it, but just want to double check.
I am good, thank you.
Okay. Christine made me coffee. Lindsay made me a cake this week. Yesterday, all of the directors had cake for breakfast. So I just want to say, if we are especially like talkative and happy today, it's because we're still living off of the breakfast cake we all ate yesterday. In honor of National Nutrition Month, we ate a cake for breakfast. So you can blame Lindsay. Kelly is here, and Kelly was in the Capitol today, as she is often. So I'm sure she has lovely updates for us right now. Kelly.
Yes. Hi, everyone. Lots of state updates for you all. Based on the pace of things, there's a lot going on. So since we last spoke, there is a revenue forecast that landed last Friday. The notes we got from CalFO's lobbyist is that it looks like the forecast is it's not wildly different than what the forecast was in December for the legislature. However, with the decisions that Joint Budget Committee has already made thus far, they are overspent by quite a bit. So they'll probably need to be revisiting some funding decisions that they've already made. Sounds like they are working really hard this week, hoping to get the long bill introduced. I've heard Monday as a target date. I think we're waiting to see if that is going to be a date that they can keep with all the moving pieces going on this week. A piece that we'll be watching carefully is that they did make a decision a few weeks ago to award the full $12 million ask CalFO had prioritized for continuing the funds that were started with Senate Bill 243. So that was great news for local public health, really exciting. So we'll be working to make sure, I'm sure CalFO more so than anyone will be working to make sure that that 12 million remains unchanged and gets into that long bill. So we'll be keeping an eye out for that. Which is really exciting. We've also been trying to better understand what's going on with the funding for the Healthy School Meals for All program. Some of the math has worked out differently than it was originally looking like it would be in the Blue Book when that was voted on by Colorado voters a couple of years ago. There's a marked difference in the amount of funding that they thought they'd have versus what they do have. I learned earlier today that it sounds like the Joint Budget Committee has awarded some of the state education funding to keep that program going for the rest of this school year and into next school year. But I think some additional solutions will need to be sought around that. So we'll work to better understand kind of the details on that for you all, since I know that was something you all as a board had engaged on when that was going to ballot. We're also working on a handful of other bills. Some of the bills that were previously introduced had kind of stalled out while everybody was waiting on the revenue forecast, and some of the budget decisions were paused for a bit. Some new bills were introduced that we've been pretty active on. Why I was down at the Capitol this morning was working on a bill that has to do with public notifications related to hazardous chemical spills and releases. It has a lot of very detailed notification requirements that would fall on county emergency management and then also on public health for provider notifications that really take the discretion of how those are handled using typical emergency management and response practices out of our hands. That would put it into statute. So the Emergency Managers Association is working on this. We're coordinating with our county manager on this as well to try and outline some of those concerns, particularly that all these new requirements would not be accompanied by funding as the bill stands now. We're also looking at a bunch of environmental health bills. Those landed in the lull while we were waiting on the budget. There are a number of air quality related bills. There's a gray water related bill that all seem to have good intent, but have a lot of nuance and impact that we're working to untangle. Also seeing that some of them are not set up for success potentially with the administration with Governor Polis. So a lot of things being worked on there in terms of what local role or impact might follow to the local level, which doesn't necessarily mean public health, might mean county, might mean local utilities for different parts of those bills. So a lot of work to try and unpack them and figure out how best to engage county commissioner level as well as CalFO and CPHA as well. And then there are some updates on our tobacco bills. So there was one we were watching closely, Senate Bill 22, that would explicitly give counties the ability to pursue flavor tobacco policies at the county level. Right now, municipalities can do that, but statutory counties don't have the explicit authority to explore those policies if those are a fit for the community. That bill died, unfortunately, a couple weeks ago. But we are continuing conversations with our commissioners as well as with the public health associations on larger, more comprehensive preemption needs around tobacco policies. Flavor is one piece where counties don't have the same authority, but there are other things like distance requirements, how we define what a youth serving facility is, that are also limitations to local authority over tobacco control at the local level and enforcement. So helping those conversations continue. And then a new tobacco bill that was introduced maybe a week or so ago around prohibiting tobacco products that don't have FDA approval. There's some caveats in the bill that we have a little bit of concern with because it would include those that have applied for FDA marketing approval, not just the ones that have been approved. So we're unpacking that a bit as well, and we'd probably be continuing conversations with CAFO on that one. That's a lot. So let me know if you have any questions for me on any of that, and we'll continue to keep you updated too.
Thanks, Kelly.
I was
Kelly,
muted.
busy.
Sorry. Questions? Okay.
Joe's up next. Joe's gonna introduce our employee of the month.
Yes. Good afternoon, everyone. I see that it's already been revealed. So
Yeah, sorry. I had to put it in the written record.
but that's okay. Good afternoon, everyone. I am really, truly excited to announce this month's Employee of the Month. And this employee really does model the way and set the standard for excellence in our department. You know, under this lens, Sarah Arnsman really does stand out. For reference, you know, Sarah is a member of our health IT team in the Administrative Services Division. She stepped into her role where we needed data management for within the clinic, and she really has brought to light areas of our billing process and client procedures that needed attention for shepherding in the next stages for our department. It shouldn't come as a surprise with all of her work in the clinic that Max Johnson, our clinic director, actually nominated her for this. And I say that in such a way because he kind of beat me to the punch. We, you know, in this new process, we really had to really look at our teams and look at the division and look at the department as a whole and see who really stands out. To see that nomination come in from Max, that really drew the light to Sarah. I mean, that really made her stand out even more so. Her efforts were very clear to me. The atmosphere she encourages in the department is really apparent to me. But seeing some of the comments from Max, and I'd like to read a couple of them if you don't mind, really solidified this process in this nomination. You know, Sarah has worked, this is from Max, Sarah has worked exceptionally hard to improve how we engage with, communicate to, and reduce burdens for all clients of clinic services. There has not been a single week in the last 6 months where Sarah has not found a new way to improve our services, whether it is increasing efficiency, catching billing process issues, building out procedures to help us create a data culture, reducing barriers to access and scheduling, or just being an expert set of eyes while we plan for the future. Sarah is both willing and enthusiastic about improving lives and building partnerships. Sarah also reports to, and it goes on. It's a pretty lengthy acknowledgement of her dedication, her support for clinic services. I also have comments from her direct supervisor, Larry Armstrong, our health IT supervisor. Sarah's impact on JCPH has been apparent from day one. Sarah has consistently brings forth innovative ideas and actively collaborates across programs and departments, fostering trust and understanding throughout the organization. Despite her humble nature, Sarah's contributions are undeniable and essential to the team's success. Sarah is, I roll my eyes a little bit, so I can't believe I'm reading this. Sarah is worthy of this recognition. Here's where it is. Sarah's love for sneakers is prudent as she is always running to get involved in new projects. I can't believe that Larry had to sneak in that dad joke, and I can't believe I read it. but it really emphasizes the culture and that environment that Sarah really brings to the team. She truly does stand out. She really, truly does model the way. I am so happy that she is this month's Employee of the Month, and it is well deserved. She's amazing, and I'm happy that she's on our team. So Sarah, congratulations. You really do deserve this. You stand out amongst a sea of amazing staff members. Please continue to do the amazing work that you do every day. Thank you, everyone.
Thank you.
Oh, Sherry, are you talking? Sherry's on mute again. Yeah,
I think Lindsay muted me.
of course. There was Sarah.
Congratulations.
I just saw Sarah's face pop up. There it is. Wave to your adoring fans, Sarah.
Hi, thanks everyone.
And I hope the board members will get to join us for lunch. Those of you who can get to meet Sarah in person. And one thing that Sarah won't say about herself is Sarah is just such a joy for the actual physical office. Like Sarah is in the office. She has created a wall of dogs, like dog pictures of staff's dogs. She wrapped like the entire suite in wrapping paper in the holidays. Like you meet Sarah and you think, oh, she's an IT genius. And then you find out she's also incredibly kind and incredibly devoted to making this a really joyful place to be. She makes other people want to be here. And that to me, as the executive director, is more than I can ever ask for. So she is probably so embarrassed right now by all of this attention. But and thank you, Joe, for reading Larry's dad jokes. I appreciate it. Alex, I'm sorry, I left the S off the end of your division again. I keep accidentally forgetting to put partnerships plural at the end of the new division name. So my apologies.
No worries, practice makes perfect. And I will also just say, while that for Sarah's clinic was highlighted in that, I will also say Sarah is invaluable to many of our programs and community health partnerships as well too, and has been a tremendous partner in helping us to navigate some of the tricky situations we never imagined we'd have to do around Medicaid billing and documenting in multiple systems. So we are also incredibly grateful for Sarah as well. And I have the exciting news of sharing some updates around, well, it's actually Family Connects in the news. We put out a press release back in February announcing our partnership with Lutheran Medical Center in bringing Family Connects to Jefferson County. And thanks to our great comms team, we had a number of media partners that picked up the story. And I want to say a tremendous thank you to the staff who jumped into these interviews. None of them had ever done this before, and they all did an absolutely amazing job representing the program. And you would never guess that it was their first time doing a media interview. So our first one was with Telemundo and was done in Spanish. And that was one of our nurses, Amy Sue Pinto, and then Rosie Ramirez, who is our program support specialist, did a beautiful job with that interview. And then the second piece was with the Jeffco transcript, and that was Kate Follett, the nurse supervisor, as well as one of our family ambassadors was also spoke to the Jeffco transcript as well about her experience and desire for a program like this in Jeffco. And then the last piece was an interview with Denver 7 with Kate again, talking about the program. And then it featured a family who had actually received a Family Connects visit. And we had reached out to them because they had provided such a nice review of the program. And so we reached out to this family and said, any chance you'd be willing to let Denver 7 come into your home and interview? And they were very gracious to say yes. So a big thank you to them. But if I think we can share out the links to the interviews with the Board of Health. But again, a tremendous thank you to the team for this.
Thank you.
Awesome.
It's just great fun to listen to all of this, isn't it?
I feel like we're just bragging and telling you the fun stuff that's happening. I mean, but really, it's been such an eventful month post all staff retreat. The last 45 days
Yeah.
have been just hard, but also great. A lot of investments we're making are kind of like we're sowing seeds and we're seeing fruit. And so that's very exciting. Last but not least, and just as a reminder, because we've shifted towards not everyone has to talk. Jim, I believe Jim is on. I just want to recognize Jim because one of the reasons that you were not hearing a lot from environmental this month is because Lane is not with us this month. We do have some follow-up on the on-site wastewater treatment systems that Mitch talked about last month, I believe, or the month before, but we do have some progress and kind of legal advice on that we'll be bringing to the agenda in April so that Lane can participate as well with his background. We thought it was good to wait on that. So last but not least, Max Clinic Services, who is telling me at any moment we could have that van rolling into our parking lot. I've got my scissors, I've got my ribbon, I'm ready. But Max is going to tell us about the amazing opioid event we went to a little while ago.
Absolutely. And the van is coming Thursday or Friday. Just have to schedule a time with them. They just texted me a few minutes ago, so it's coming. And also, before I jump into G-Rock, I would also be remiss if I didn't also say congratulations, Sarah. We absolutely love you down at the clinic. You're wonderful. You make every project that we're working on so much better. So thank you for everything you continue to do and the ways you show up with these amazing ideas each week. You're the best. Congratulations. So I'm just going to touch briefly on the Gateway to the Rockies Opioid Council. It was our 2024 conference. For anybody that doesn't know, it is a way for stakeholders, community members, and elected officials to collect and come up with solutions to help the community with opioid response. And building out harm reduction tools, informatics, all of those things, and building partnerships as well. So it's a great way for everyone to get together. Like last year, there is quite a showing this year. I don't have the exact number, but it was dozens of people that showed up with a lot of different voices from a lot of different backgrounds. The three biggest speakers were Dr. Josh Blum. He is the Director of Outpatient Substance Use Disorder Treatment for Denver Health, and he gave a presentation on trends in substance use and treatment. The Attorney General, Phil Weiser, he showed up to talk about combating the Colorado opioid crisis, as well as where the funds came from, how they're split apart, all those things. Really gave a financial breakdown and the efforts behind getting those funds from the cascade of lawsuits that I'm sure everybody has seen of pharma companies around opioid response. And then Representative Chris DeGrew-Kennedy, he is the chair for the Opioid and Other Substance Use Disorders Study Committee. He was just talking about legislation work being done and engagement with state experts around opioid use and response. So he had quite a bit to share. It was a pretty lengthy one, but he did a good job of just kind of explaining what the playing field is and what they're still reaching for. But the most important thing, and I think Dr. Story would hardly agree with me, was when they had the young people weigh in, and that's literally what the section was called, Young People Weigh In, Lived Experience. And it's about a bunch of kids. I believe the youngest was 16, if I'm not incorrect there, and then the oldest being 19, shared about their engagement with substance use, their history of substance use, how they've gone through treatment, how they've enacted with their families, their peers, what school systems, and what they thought we were missing, the things falling through the cracks, how they thought we should either respond, change messaging. They came up with ideas, but really it was their opportunity to share their lived experience with everybody through a lens that is, one, only able to be sought through lived experience, and two, can be lost to time. As we age, we have different life experiences. We forget what that landscape of being young looks like, and what your day-to-day life can entail, and all of those different touch points for where there can be improvements in communication and support. So it was a really a wonderful board to have, and everything they shared was a great takeaway. And I already hearing people trying to put it to action, and I know it's something that we are taking seriously as well. You can get the notes and the slides, and there's plenty of photos on their website, and they post it openly. I'm actually going to drop it in the chat, because just telling you to go to www.gatewaytotherockiesopioidcouncil.org 2024 conference probably isn't going to be too helpful for many people. So I'm just going to drop that in there for anybody that wants to go and take a look at who showed up, how they showed up, and all the things we covered. But it was really an enriching experience. I look forward to next year's, and I look forward to this coming year and all the actionable items and work and relationships that came out of it. So that is it. Are there any questions? All right. Thank you, everyone.
Well, that's it from us.
I don't have a question, but just a comment. Because it is so important, the work that they've done on the opioid. I just wish people weren't so afraid to talk about alcohol. I know you all knew that was coming, because it is such a killer. And
Yeah.
so,
We are
anyway, but
exploring
I am
that.
really happy about the opioid. Don't get me wrong. Do not
Yeah.
mistake that.
For sure. And we are, those opioid councils are kind of like decision-making bodies actually for funneling settlement money
Right.
to local organizations. So I can see the setup of that, but I'm sure Kelly's still on, I won't put her on the spot, but one of the recent introduced bills is looking at alcohol tax increases to fund mental health treatment. And
Yeah.
so that's new, and we haven't like done a thorough analysis, but I do know that it's going to be discussed at a Friday meeting I'll be at of the Metro Denver Public Health LPHAs, and exploring, I know with CalFO as well, like I think people are just like, what is this? What's going on? Who's sponsoring it? What are the repercussions? Because we do have, and it did come up at the council, it did come up at the conference. Someone did ask the question like, okay, but Colorado has the lowest alcohol taxes in the country. We have some of the highest alcohol related deaths, and not just what you think they are. So it's important to me. I'm not scared.
No.
I don't
You're
get paid
definitely
by
not.
I don't get paid by Coors, yet. So but I want to make sure we're not, much like tobacco, like that these bills pop up because it is very timely, but they're actually industry bills repackaged as something else. And so that's why I have got Kelly and Max, and I know Sarah, like I see Sarah chomping at the bit a little bit, because she knows like it's so easy to get tricked a little bit by some of these copycat bills that just get cranked through in all these different states. And so due diligence, but
Yeah.
it is something I would support if there was a good structure for funneling the extra money, or,
yeah,
thought it would work to reduce
one thing I
consumption.
do want to make clear, I was not speaking about anybody in the health departments, because they all get it. You all deal with it all the time, but
yeah,
policymakers have been really, kind of, they shy away from trying to do anything about it. But I'm glad
it's
to hear
big business.
yeah.
It's really big business. And I will say, like, from a public health perspective, and we're really focused on prevention, if we could increase revenue for prevention, it's great. I don't see and now I'm putting my economist hat on, like sin taxes don't often reduce consumption to the point where we would see like a discernible impact.
Yeah.
There are many things we can do as public health to turn the tide of demand that aren't regulation. And so I definitely think it's something we need to put on our priority list. I think the economic stability and mental health portions of the chip are also related to this, and partially we need to layer that in as context. Anecdotally, we went to the RIHEL. Many of us were at the RIHEL RSVP rendezvous bash or something that happened recently. And I thought it was really amazing. It was a real public health moment. Some anonymous donor had covered the bar tab for all non-alcoholic drinks. And looking around that room, everyone, I think people can attest to on this call, it was like, you mean I can drink all the LaCroix I want? And I had multiple artisan sparkling waters. I'm looking around, very few people were drinking alcohol because the environment changed. The incentives changed. We didn't have to spend money, And so that was just public health 101, And so it was really great to see it in action in an event that was public health sponsored. And so, yeah, we hear you. We're with you. We'll just see how this bill shakes out too. We're just going to keep an eye on it. So, Kelly, anything to add on that?
No, nothing that you didn't already cover. And it's already been flagged for CAPO's next policy meeting. I think it was introduced maybe the day after we met last. So I can get an update from that conversation to bring back to you all. And I would echo Dr. Story that I'm hearing alcohol come up in more and more conversations. Granted, a lot of those are public health conversations, but that even of itself is encouraging to hear more and more folks putting attention on the impact of alcohol as another substance in our community that we don't spend as much time on or have as much resources for as we do for things like opioids.
Well, thank you. I didn't mean to go down a rabbit hole, but
We love it.
Sometimes I do that.
We do it all day, Sherry.
Well, are there any questions? Max, thank you.
Thank you.
All of you, thank you. Anything else, Dr. Story?
I'm good. I'm good if you're good.
Okay.
Thank you.
Thank you. Are there any other staff comments? Okay. Oh, Mitch Brown has raised his hand.
Yeah, Mitch Brown.
I have to always remember who ML Brown is. It's Mitch.
Hi, good evening. Sorry, I probably should get that changed, but I just want to say thank you, Sherry. You got to have that chat. And one thing I did want to follow up with you on is so on our chat, you had made the suggestion about a disclaimer or notice on our septic permits about who is responsible for maintenance of the septic systems. Craig beat me to it, and I think beat you to it. We do have that language already in our permits, so it was a good idea, and it's there.
Okay, thank you.
Yeah, thank you.
Okay, we are to Board of Health comments, and it is my understanding that we have one of our board members has got something that she wanted to bring up, and so I will just turn it over to Rochelle Woods. You have
Thanks,
something that
Sherry.
you wanted to bring forward.
Yeah. And this is a good night to bring these things forward. It fits in good with things we've been speaking about. First thing I want to bring up, while not directly public health related, it still has to do with our community and the folks that we serve as public health individuals. I wanted to point out to everybody that the Arvada Center will be doing Spotlight Jeffco between April 5th and May 5th. So that's coming up soon. And what that is a celebration of the Jeffco Schools Foundation High School Arts. They're going to be focusing on about 400 works from 23 different Jefferson County schools. And then they're going to be focusing on 2 Jefferson County community members who are artists, one of which is a Columbine High School graduate. Her name is Robin Cole. And Matt Christie, who is also a Lakewood resident. So I did want to throw that out and let everybody know that Spotlight Jeffco is coming to the Arvada Center.
Well, thank you.
Next, I'm going to kind of piggyback off of Max to kind of segue into this next thing I wanted to bring to all of our attention. Max was talking about the opioid event, and Sherry, you had brought up, alcohol and substance use. I want to tie those in to some of the exceptional work that our Jefferson County Coroner's Office does. Our coroner, Annette Cannon, very much advocates for substance use and opioid, especially interest within that, in suicide prevention. And the reason I bring this up is because those things are public health measures. And our Jefferson County Coroner's Office does inform us on deaths related to things like overdose and suicide. And these are things that we focus on as public health personnel and bettering Jefferson County. So I want to point that out and then segue into why I bring up our coroner's office outside of those things. I wanted to make everybody aware that in the news here not too long ago, I'm going to say about 2 weeks ago, the Jefferson County Coroner's Office was given a shout out because they were able to solve a 2000 cold case. They partnered with Orthram, which is in the Woodlands, Texas. They worked on getting a forensic grade genome sequencing done on an unidentified Jane Doe from Jefferson County. And they were able to then work with our law enforcement here in Jefferson County to identify that person and to solve that case. So I think that that's a great highlight of the work that our coroner's office does. And it does support public health. So I just dropped the article link into our chat. So if you want to read more about that, please do. And again, a huge shout out to Annette and her team. Next, I wanted to make mention of IBCLC Day. That was March 6th. And IBCLC Day celebrates the International Board Certified Lactation Consultants, which we have on staff here at Jefferson County. So I wanted to give a huge shout out to our lactation consultants, our IBCLC certified lactation consultants that we offer at JCPH. IBCLC Day celebrates the extraordinary services that these team members provide to expectant parents and new mothers. They are the highest accredited experts that specialize in breastfeeding and lactation. And they do a lot for our families. They help establish optimal breastfeeding routines. They help new families work through issues such as helping with latch, helping with increasing milk supply, breast anomalies, cleft palate, multiple things that can be challenging to new families when it comes to breastfeeding. And they also help with other common and more complex lactation challenges as well. Something that I always like to point out, because most people don't understand just how fortunate we are to have these people on our staff. These employees are incredibly dedicated to breastfeeding and the success of new families in regard to breastfeeding. To become certified as an IBCLC, this requires multiple hours of lactation-specific education and up to 1,000 hours of lactation-specific clinical practice in an appropriate supervised setting. That is unpaid. I just wanted to throw that out there. These folks are so dedicated that they are dedicating 1,000 hours of their time to be able to sit for this test that they then pay out of pocket to also do. So it's quite the dedication. The test that they take has over 175 questions. It's taken by a monitored proxy, so it's a serious test, right? And then to maintain their certification, this requires continued maintenance and education. So they have to do continuing education and get credits for that. And again, most of the time and requirements here are done independently, meaning it's on their own dime and their own dime. So we are so fortunate to be able to offer these very highly skilled and dedicated professionals to our JCPH families. I think that's incredible. And then I'm going to take it a step further. I know Alex already mentioned Family Connects, but I also did want to give a huge shout out to the Family Connects program. As Alex said, this program brings nurses into homes of new families for postpartum checks. And again, not only for lactation support, but the nurses that are going in are able to interact with these new parents and they're able to really support new moms. And this is huge because there can be a lot of issues for some as far as with maybe feeling postpartum depression, having issues with things like that. We have our nurses going in and they're able to lay eyes on these folks and to help these families navigate these or maybe get additional assistance as needed. And I think that that is really huge. During these visits, which I believe are 2-hour visits, the nurses are also able to check the baby. They talk to the mom. They inquire about physical, mental health. Statistically, Family Connects has shown that they provide a 50% reduction in emergency department visits and hospital overnight stays through the first year of a baby's life. They've shown a 44% reduction in child welfare involvement through the age of 2. And mothers reported a lot less anxiety. And that's huge for new moms. Just to have that comfort and to have somebody there to say, you know what, you're doing great. You can do this. That's huge. So I want to give a huge, huge, huge shout out to our IBCLCs on staff, as well as our Family Connects nurses doing that extra mile for our newest members of Jefferson County. I think that's incredible. And then I've asked Lindsay if she could please go ahead and play that Denver 7 interview so that we could all see that as well. So I'm thinking she's got that up and she is going to roll that for us. And that's all I wanted to add, but I wanted to make sure that that we gave a good mention and shout out to these folks.
It is sometimes known as the 4th trimester, the time after a baby is born when they still need a lot of support, and so does mom. But we know that many women don't get a follow-up with their doctor for about 6 weeks after giving birth. I found out about a new program, though, that's providing a lifeline for families in the metro much sooner. Look at this one. You can always tell when you're in a house with a new baby. Oh, a joyful time, but it can be overwhelming too.
It sounded amazing to me just to have somebody, you know, come to us instead of us trying to, you know, get out of the house with a newborn and a toddler.
Jeffco Public Health's Family Connects program is bringing nurses to homes like Maddie's for a thorough postpartum visit.
We know that roughly 95% of parents with a newborn say that they need support during that initial postpartum period and don't know where to find it.
Careful for Yuki. The results of a pilot program were impressive. Families that got this type of support had 50% fewer ER visits and hospital stays during the first year of the baby's life. Moms reported less anxiety and child welfare involvement fell.
So when you go into someone's home, you're seeing them where they're comfortable. You're seeing how the family interacts with each other. It can be a great way to clue into other resources that a family might need and not know how to ask for.
So Maddie got so many of her questions answered.
And then there was just little things that kind of came up in the time she was here. So it was, you know, like the baby made a certain noise and it's like, oh, do you think she sounds congested? Or like, is this something to be concerned about?
Ultimately, the goal is to make sure that moms get as much attention as the babies and that the support doesn't end after the hospital.
And it was really just like sitting down with a friend that's also a nurse.
And Jeffco has partnerships with Lutheran Medical Center and Denver Health right now to reach out to those families. But Denver is also planning to launch a Family Connects program soon. It is
That's awesome, Lindsay. Thank you. I just couldn't help but have us all take a look at that video and just celebrate that team for their awesome dedication and work.
Thank you, Rochelle. That was great. You are a wealth of information. Thank you. Thank you. And congratulations to all of you. When you just notice, you don't think anybody notices your work, I have to tell you, yes, we do. Any other comments from the board members? Sarah, did you have a comment you wanted to make? I saw your mic go up.
Yeah.
Or go off.
So my comment is, I guess I'm just full of curiosities and questions today. So coming up before our next board meeting, the first full week of April is National Public Health Week. So an opportunity for us to really celebrate the work of public health and ensure that we're spreading word and understanding about the field of public health to a broader audience. I'm curious, my curiosity is around whether the county recognizes National Public Health Week or if there's anything we can do as a Board of Health to recognize it and bring it to the attention of the county commissioners or the county in general for that. There, I see your hand raising. I'm wondering if you're already doing it, but
It was a great, I had my feet up. I like to relax while I'm listening to everybody. And that interview made me cry again. That like Denver 7. So thank you, Rochelle, for that idea. We have some things planned and we do need your help. So thank you for the reminder. And that way we will follow up on email. National Public Health Week, I think it's first week of April, around then, second week of April, I always get confused. That is when we're going to be publicly releasing the chip. So that's one thing we'll be doing. So your amplification of that will be great. We have some good social media, but most importantly, and you should all have gotten an invite or will receive an invite. I think you should have gotten an invite by now. The Public Health Champions event is where we are going to have it at the County Administration Building. It is celebrating our community partners and like cross-sector relationships and showering them with praise. And we will be reading the National, Commissioner Dahlkemper will be reading the National Public Health Week recognition declaration. So there's lots of fun stuff. There will be refreshments. And if you didn't get that invite or you think it went to spam or you need another one, Lindsay will help you get connected to that. But I have to make a speech. Lane is handing out trophies. So that's a great opportunity. And I would say the consummate show person, I would say lots of selfies, lots of pictures while you're there, lots of tagging other people and sharing is always really helpful for us at events like that. So we're excited. I think county manager is going to be there. So be a really good time. But thank you, Sarah, for that reminder that I think in this forum we should have mentioned that. So sometimes I get my calendar mixed up with where the board meetings sit in relation to the event. So appreciate it. Thank you.
Thank you, Sarah. Okay. The only comment that I would make would be, wow. I mean, how do you follow any of that? You all are should be incredibly proud to be with Jefferson County Public Health because all of you do such an amazing job and we do notice. So thank you for all of you. And also I wanted to give a shout out to our county folks. I'm not sure if Carrie Markle that you participated on that, but I understand that you were very instrumental in the the county the secure transport thing. So we want to thank you for that and your help that you gave the department. And that, unless there's anything else anybody wants to say, we'll conclude our meeting. We appreciate all of you coming. Thank you. Thank you. Happy spring.
Thank you all. Bye.
Thank you.